So where are we now?
So we are in the radiologist's office. So Dr. Runyan is actually reading a mammogram. And so these two monitors are here. I can't show you just due to HIPAA. But these two monitors right here, they communicate with all of our mammography machines throughout the market, from Coastal, Hilton Head, and here. And this is how he reads the 3D. This is what I was telling you, that they're able to kind of scroll and see millimeter slices of the breast tissue. And so anyway, and then also whenever we do diagnostics, we come in here and there's 10 of us in here at a time sometimes, yeah. And so anyway, we let him read our diagnostic mammogram. He recommends whether or not we need to do an ultrasound on the patient. At that point, then the technologist lets the ultrasound techs know. Then they go in and have an ultrasound, and then the radiologist goes in there and gives the patient the results. And Dr. Ringer's office is just right next door, so that's how we work so closely together, and that's the reason our breast health center is amazing. It's just because they, work so closely
Everybody
together.
really does collaborate. It's a complete team approach.
Yes.
I mean, an amazing group so far. We got to actually go see the stereotactic room for breast biopsies too, which was pretty fun.
And then we have our MRI machine, which is in the back.
Okay.
We do abbreviated MRIs for women that are high risk, and then we do just MRI of the breast for new diagnoses, or women that are 20% and higher, they get a full force MRI. If they're 16 to 20% of a lifetime risk, we recommend an abbreviated MRI, which is just a smaller scale MRI, but it gives us the information that is so sensitive to the breast tissue that it just gives us a little second look of something to be able to look at their mammogram 6 months later, look at an MRI, and then if anything was to ever just pop out at us, we're able to get it really, really early.
So let's say we're at this point and now we have seen something that we're concerned about. Is that where the collaborative nature comes in? Everyone kind of gives their point of view, and then what happens to the patient?
So the patient has a mammogram and we let the radiologist review it. At that point, he gives us his recommendation of what's next.
Okay.
So either we are telling the patient that it's normal, or either he's going in to do an ultrasound and he's going to give that patient results. Our radiologists do tell our patients if they need a breast biopsy, and then after they do that, then I consult them.
Got that.
And then after we consult them, depending on what their physician wants us to do, I either schedule it or I explain to them they're going to be referred to Dr. Ringer.
Oh, it's an amazing, fine-tuned process. Thank you. So Angie, it's really interesting. Dr. Runyan, who happens to be my son, am I allowed to say that? I mean, I can't not say that.
That's
exactly.
Right.
We're talking about the collaborative nature of the breast center here, everyone working together. We're talking about what sets you all apart. And Angie, you said it'd be interesting to have Brandon talk for a minute about what? What do you want the patients to know?
I want the patients to know, we have a very strict policy and procedures that we follow, because we feel like that with our breast tumor board, our breast board, which includes Dr. Ringer, and a bunch of the other physicians that are in here. They meet quarterly and they decide what the best thing is for our patients. And I just want our patients to understand that things that we do is for the best of our patients.
Correct, the quality of care.
Right, the quality of care and the standard of care. And Dr. Runyan can explain that a little bit more when it comes to like screenings.
Yes, and we talk all the time about breast density, because I don't really understand that. Talk to us about the importance of the team and about what you all do and your protocols.
Sure. So when it comes to breast density, there's our new laws that basically have patients informed as to what their breast density is.
Okay.
Breast density is important for a couple reasons. One is it increases the risk of breast cancer. So it's an independent risk factor for breast cancer. And the second reason is it can really make the diagnosis more challenging on mammograms and can make the diagnosis more challenging on ultrasound. which is why for women that have heterogeneously dense or extremely dense breast tissue, having a supplemental contrast-enhanced MRI can be really helpful.
Okay.
So going back to the collaborative nature,
Yes.
and one of the things that makes this practice unique is because of our collaboration with Dr. Ringer in her high-risk clinic, we can really better tailor the individual screening needs for the woman on a basis not just of their risk factor due to family history, but also on the basis of their genetic risk factors and the risk factors with their breast density. The breast density is really one of those things that can push women towards having a more frequent screening regime, and also might necessitate having a contrast-enhanced MRI examination as being a critical part of that overall screening.
What does that mean, a contrast enhanced?
So for any kind of breast MRI that we're doing where we're looking for breast cancer,
Okay.
it's really the contrast that allows that cancer to stand out against the dense breast tissue.
Okay, I got it.
One of the problems, so with mammogram, because the cancer is the same density as the dense breast tissue, it could be really hard to see that,
Got it.
what we call in radiology contrast resolution. Once we add that contrast, it really amps up that contrast resolution where we can see the abnormality. With ultrasound, it can have a lot of the same problems as mammography. So a lot of people who seek other alternatives, such as whole breast ultrasound, they also have the problem where they can have difficulty identifying the abnormal lesions in the breast tissue.
So some people who may think that they want an ultrasound, that may not be the appropriate fit. Or
Yeah, well, I think a lot of evidence has really come out that you really need to have a contrast-enhanced examination in those patients. So it was unclear for a long time, but it's starting to become much more clear that the contrast-enhanced examination is really important for imaging dense breast women, especially those at increased risk.
So, go ahead.
And it used to be before 3D mammography, which is now the standard of care.
Correct.
We only had 2D. And when they started the density laws, they would recommend women to have a 2D mammogram with an ultrasound.
Got it.
But now we don't follow that anymore because breast MRI is more sensitive to the breast tissue. So we follow mammography with MRIs.
It's absolutely fascinating. I think part of the goal of doing this and what's so impressive is demystifying some of these things that I think are